WKU Health Services dates back to the early 1970s when it was located inside the academic complex. But the primary care center has expanded, along with enrollment, to meet a variety of healthcare needs for faculty, staff, and students. Dr. Alan Redden has been a staff physician at WKU Health Services for nearly 13 years. He enjoys relating to the college students.
It's a time in their life when they're probably on their own for the very first time, often using health care for the very first time without their parents present.
He says the current services have come a long way from what was offered even 5 years ago in their old location.
We started off with just several exam rooms down one narrow hallway. The building was built in the 60s, I believe, and it was very difficult to move around in that part of the building.
That changed with the opening of a brand new building in 2008. The accreditation process started the following year and was achieved a few months ago.
I think it should give everyone confidence that we are a top-notch facility.
Lab manager Monisa Wright has been around since the early 90s. She's also witnessed the dramatic improvements firsthand.
It was not as well lit. The hallway was more narrow, and the laboratory was so small.
The current lab stays busy testing for strep, mono, flu, conducting drug screens, and much more. Wright says they provide a lot more health care than people may imagine.
I know that there is this lingering perception in some people's minds that a college health service is a nurse sitting in a little corner and maybe a doctor who's retired. And that's not the way it is.
WKU Health Services hosted a reception this week to celebrate the accreditation by the Accreditation Association for Ambulatory Healthcare. With this week's View from the Hill, I'm Amy Bingham.